Hi, my name is Sue Hogan and I am a parent education midwife at the Rotunda Hospital. Today I'm going to chat with you about baby care and going home. So we'll start by chatting through what to expect before you go home from hospital. So one of the checks that will happen on the day you're going home is your postnatal midwives check. So this is a head-to-toe check of you to ensure that you're recovering well after having your baby. Your midwife will chat with you about how you're feeling emotionally, and we'll often ask you to complete a 12-question questionnaire called an Edinburgh Postnatal Depression Score. We'll score this with you, we'll discuss the results, and we'll give all women advice around our perinatal mental health department and how to reach out on discharge. We'll also chat with you about how your breasts are feeling and breastfeeding. If you're breastfeeding, we'll observe a feed to ensure that baby is latching on well, and we'll also chat with you around support networks available to you in the community. We'll also chat with you about postpartum bleeding, also called lochia. We'll give you some advice around what to expect. So generally this bleeding will last up to 6 weeks postpartum, and what wouldn't be considered normal with this bleeding would be any offensive smell, any large clots bigger than a €2 coin, or if you were soaking a maternity pad within an hour. Okay, so heavy bleeding, large clots, or an offensive smell wouldn't be considered normal, and your midwife will go through all of this when you're going home from hospital. Your midwife will also, with your consent, have a feel of your uterus. So we'll ask you to lie on your bed and we'll feel your womb through your tummy and through the skin on your tummy, just to make sure that it is well contracted after giving birth. If you have any stitches, so an abdominal wound from a cesarean section or perineal stitches, we'll always review your stitches before you go home from hospital, and we'll also talk through, what to expect in terms of healing, and we'll go through any signs and symptoms that you should look out for if there were any worries or concerns. And we'll also check your vital signs and answer any questions that you have. If you have a cesarean section, you'll always be seen by an obstetrician as well. So the obstetrician will review you after your surgery just to ensure that you're recovering well. And once they have documented a note in your chart to say that they're happy for you to be discharged, anytime after that we can organise your discharge from hospital. If you have any questions about your cesarean section, for example, why it happened, or if there were any concerns you had or anything you were wondering about, I always think it's a good idea to get those questions answered with your obstetrician when they come to the bedside to discharge you from hospital. Prescriptions. So most women won't need a prescription when heading home from hospital. Generally, the pain relief that women would take postpartum is ibuprofen and paracetamol, and we can get both of those medications over the counter, so no prescription required. However, every now and again, we may have a woman going home from hospital taking antibiotics or medication for high blood pressure. So if you do need a prescription, we will absolutely organise that for you before you go. I think it's very important, if you do need a prescription, that you do ask your midwife, what are you taking? Why are you taking it? How long are you to be taking it for? And if there's any follow-up needed. So it's important that you're aware of all of those things if you're going home from hospital with a prescription. In terms of follow-up appointments, the majority of women are going to have their 6-week postnatal checkup with their GP. So again, that's a head-to-toe check with your GP. Again, they're asking you how you're feeling emotionally, how the feeding is going, or how your breasts are feeling. Has your womb or uterus gone back to its pre-pregnant state? Has the bleeding settled or stopped? Are your vital signs normal? And again, they will answer any questions you have. They'll usually check your stitches, whether it's an abdominal wound or a perineal wound at that check as well. If you're attending the hospital privately, often your private consultant will offer you that 6-week checkup as part of your package. And then from time to time, we have women who experience gestational diabetes or high blood pressure during their pregnancy, and In those instances, you may be given an appointment to come back to the hospital for follow-up, so a glucose tolerance test, maybe a blood pressure series, maybe a visit to the perineal clinic. But those specialist clinics would always be as well as that 6-week checkup with your GP or hospital consultant. And before you bring your baby home from hospital, there are a few checks that we want to carry out on baby as well. So the first one is the newborn clinical exam. So this can be performed by either a pediatrician or a senior midwife who has her baby discharge exam completed. So with the newborn clinical exam, it's a head-to-toe check of baby to make sure that baby is clinically well to go home from hospital. We're starting off up at baby's head and we're checking baby's fontanelles. We're then having a look at baby's eyes and we're checking red reflexes, looking in baby's ears, and we'll have a hearing technician check baby's hearing. Again, we're looking in and checking baby's nose, mouth, arms, legs, fingers, toes, spine, hips, genitalia, anus. We're also listening in to baby's breathing and baby's lung sounds, and also baby's heart. We're just outruling any heart murmurs. So the newborn clinical exam, that can be performed usually at your bedside, and we are a teaching hospital, so feel free to ask the pediatrician or midwife performing this check any questions that you have. And sometimes it's nice to ask them to talk through the different parts of the check that they're doing. It's a nice way for you to learn a little bit about your newborn. As part of the newborn clinical exam, we will be checking baby's hips for hip dysplasia. And as part of that hip check, your midwife or pediatrician will ask you if there's any family history of hip dysplasia. So it would be a good idea to ask at some point during your pregnancy, your mum, dad, brothers and sisters, and your partner's mum, dad, brothers and sisters, if there is any history of hip dysplasia in the family. During the newborn clinical exam, like I mentioned, we will be checking baby's ears, and then we will be asking a hearing technician to check baby's hearing. So they will be able to do this at the bedside, and they'll just pop to the bedside. They'll explain everything that they're going to do before they get started, but basically they just have a little probe that they pop into baby's ear canal that emits a signal, and it detects a response from the eardrum. From time to time, there can be a little bit of amniotic fluid left in baby's ear from the birth, and that can sometimes impact on the ability to do the hearing check. So if that is causing any issues, we'll generally give you an appointment to come back for a repeat hearing check over the coming weeks. It's important to ensure you get all your questions answered before you leave the hospital. And a pro tip would always be to bring a little notepad and a pen in with you in your hospital bag. And as you think of questions, write them down, and then when you have your midwife or pediatrician or obstetrician in front of you, you can get all those questions answered. We'll also perform a heel prick test, also known as a NBSS, or newborn blood spot screen, on all babies between days 3 and day 5. So who's going to perform this test? So if you're still in hospital, and most women will have gone home from hospital at this stage, but if you are still in hospital, it'll generally be the midwife that's caring for you and your baby that will perform this heel prick test. If you're at home from hospital, it's quite likely going to be your public health nurse that's going to perform this heel prick test. Sometimes the heel prick test may fall at the weekend, and if your public health nurse isn't on duty, often the hospital will give you an appointment to come back over the weekend for this test. But just rest assured that when you're leaving the hospital, we will give you a very clear plan as to when and where this heel prick test will be performed. So what are we testing for? So we're testing for cystic fibrosis, also known as CF, phenylketonuria, also known as PKU, galactosemia, glutaric aciduria type 1, adenosine deaminase deficiency, severe combined immunodeficiency, also known as ADA-SCID for short, congenital hypothyroidism, maple syrup urine disease, homocystinuria, and medium chain acyl-CoA dehydrogenase deficiency, also known as MCAD. So when we're performing this heel prick test, as you can see on the screen, we're just taking a sample of blood from baby's heel. You can see on the lab form, there's 4 circles that need to be filled with blood from baby's heel. Some tips for this heel prick test would be to ensure that your baby has nice warm feet the day of the heel prick test, because we know that when the feet are warm, they will bleed easier, which is going to make this test quicker and easier for your baby. So it's a good idea to pop a pair of socks over baby's feet the night before and the morning of the test. Another thing you could do is you could give your baby's foot a little foot massage to encourage blood flow while your midwife or public health nurse is filling out the lab form. And then to keep your baby calm during the heel prick test, you could distract your baby by feeding them or doing skin to skin. With the heel prick test, no news is good news. So it generally takes about a week to analyze this test. So if you haven't heard from Temple Street Hospital within a week, that's generally a sure sign that all is okay with your baby, that baby is negative for these disorders that we're checking for. So now it's time to take baby home from hospital. So you want to ensure that baby is warm enough when you're leaving. So always dress baby in 1 layer more than you, a little hat and a cellular blanket just over their secured straps and just across their chest with their arms out. You're going to transfer baby from the ward to the car in their car seat. If you don't have a removable car seat, if your car seat is anchored into the car, that's no problem at all. In that instance, you would transfer baby from the ward to the car in their pram, and then you could move them from the pram into the car seat when you get to the car. The Road Safety Authority website, www.rsa.ie, has some great advice around child safety in cars. Your child is going to be in a car seat from when they're a newborn right up until they're about 12 years old. So that website will guide you as baby moves through the different car seat types to suit their height and weight. And finally, before you leave, your midwife will remove your baby's security tag. We'll answer any final questions you have before you leave, and we will wish you well.